When we look at the landscape and when we see communities that are of lower income, we often don't see, the big grocery stores that have the healthy food or a wide range of food. We often see places that are fast food. There may not be any grocery store at all. And so people in those areas really have to either go far and wide, in order to get that food, or they just don't have access to it at all, depending on what their transportation is like. Food access, especially healthy foods, continues to be a problem, and it's something that we continually try to look at and figure out what other things can be done in order to improve that.
Food to Families was a program to increase access to healthy, fresh foods for pregnant women who receive services at a local health center. Our role was to partner with the West Oakland Health Center to improve the health of the moms that we worked with through increasing access to healthy food. We had about 5 youth who took the produce to the corner markets, and they were very innovative and decided they wanted to take the produce on bicycle so they could be independent. So they attached a trailer to a bicycle, they delivered the produce twice a week to the corner markets, and then the moms were able to come and redeem their coupons at the corner markets where the youth delivered the food.
Nutrition is important for expectant mothers because they are the ones who are generally responsible for the nutrition in the family. And so if you're teaching them good nutrition and healthy nutrition, then they pass it on. So it's like a domino effect.
The Deputy Sheriff's Activities League created a social enterprise called Dig Deep Farms and Produce. 2011, we were approached to be included in the Food to Families project, which allowed us to partner up with Tiburcio Vasquez Health Clinic.
Once the women were enrolled, then they would see our perinatal social worker who does an initial assessment in psychosocial health ed and nutrition.
I see the moms throughout their pregnancy, once every trimester, as well as postpartum, and I do assessments, psychosocial, health education, and nutrition. So I would write for them what we call a prescription, which is a voucher for fruits and vegetables.
And Dig Deep Farms, through its growing of local produce and aggregation of other local produce, filled the prescriptions.
Food to Families does provide a nutritional class, a cooking class for the participants so that they can learn how to use the vegetables in recipes. They did have a lot of vegetables that a lot of them had not heard about or would never buy on their own.
We had a lot of different programs and projects that just pulled it together that kind of emphasized consumption of fresh fruits and vegetables in the community.
If the woman is eating healthy, the baby is eating healthy, and they will continue with those habits so that child will grow up to continue to eat healthy.
Through Food to Families, we were able to make these partnerships, these connections with people who live in our community, who came to understand the Sheriff's Office as a partner, as a human being almost, right, in their community that's interested in all of us moving our community to the next level and making it healthier.
One of the moms, Sabrina, came to the very first class and stayed through the entire program to the end. She now is a nutrition educator here at Mandela Marketplace.
We have a farmer's market every Thursday, and she comes out and she does the demonstrations for the farmer's market on Thursdays with fruits and vegetables.
The Food to Families program definitely inspired me to go out and help other people because what I learned was awesome, and I just want everybody else to be able to have that experience.
In a community like West Oakland, there is really limited access to healthy, fresh food. A program like this is important because we help increase access to fresh and healthy food.
This was the perfect fit where the health center along with the community stores were able to come together and provide a prescription as well as fruits and vegetables, fresh fruits and vegetables to the community of the pregnant women.
I think the program Food to Families can be easily replicated in other health centers.
A program like Food to Families will make the community a lot healthier.
So I think what we're seeing is, some real sustainable change from something as simple as getting a health clinic to support preventive care through food and getting community-based organizations to really say, here's all the resources available to you that will help you live a healthier life.
I really do want to thank Kresge Foundation for funding Food to Families. It's been an important part of allowing us to do something innovative that really is helping improve the health of the community.